Hey, Dr. Cheever, hope you're doing well. My name is James Means, and the action that I chose to do for this final project assignment is a football throw. It's what I've been doing for the entire semester. And there's 4 phases in a football throw. It's the early cocking phase, the late cocking phase, and acceleration and the follow through. The scapulothoracic joint. The scapulothoracic shoulder joint abducts away from the body and externally rotates. There are 5 primary muscles used on the shoulder girdle to throw a football. But the muscles used in the movements during the early cocking phase are the pectoralis muscles and the rhomboid muscles. During the late cocking phase, internal rotation is occurring. So instead of external rotation occurring, internal rotation is occurring. And the muscles used during this are the serratus anterior and the trapezius muscles. During the acceleration and follow through, the shoulder has completely rotated forward in the direction of the throw. And the agonist muscles being used are the trapezius and the serratus anterior muscles, and the plane of motion taking place at all 4 phases is the transverse plane. The glenohumeral joint. The glenohumeral joint is important because it connects the scapula and the humerus together, and it provides a great range of motion, which is important in a football throw. During the early cocking phase, an individual's shoulder is being externally rotated at the glenohumeral joint. The muscles being used are the subscularis, the latissimus dorsi, the pectoralis major muscles, and the teres major muscles. During the late cocking phase, internal rotation is occurring. And the agonist muscles being used are the teres minor muscles and the infraspinatus muscles. For acceleration and follow through, a full rotation at the shoulder has occurred, and the main muscles being used during this was the subscularis and the pectoralis muscles, and that makes sense because during the acceleration, the follow through, you're using a lot of force and power in your throw, and that's where your pectoralis muscles come into play. And the plane of motion taking place at all 4 phases is transverse. The ulnar humeral joint and the radial ulnar joint. This joint is the elbow joint. And the elbow joint is kind of easy to talk about because not a lot of movements occur. For the action that I chose, the 2 movements occurring is flexion and extension. During the early cocking phase, flexion begins to extend the elbow, and this results in a concentric contraction because the muscles in the elbow are shortening. The muscles being used to activate this are the biceps brachia, the brachialis, and the brachiodialis muscles, and the plane of motion is sagittal. During the late cocking phase, the same thing kind of is occurring. The same muscles are being used, the biceps brachia, the brachialis, and the brachiodialis muscles, but the arm is more fully flexed at this point. During the acceleration and the follow-through phases, extension is occurring, and an eccentric contraction is occurring because the muscles at this point are lengthening. The muscles being used are the triceps brachia and the anconeus muscles, and the plane of motion occurring at all 4 phases is sagittal. The radial carpal joint and the ulnar carpal joint. During the early cocking phase, abduction takes place at the wrist as it comes back towards the shoulder and the fingers are gripping the football. The muscles being used to do this are the flexi carpi radialis, the flexor pollis longus, the extensor carpi radialis brevis muscles, and the flexor digitorum profundus. During the late cocking phase, abduction is still taking place and the same muscles are being used, but an isometric contraction is occurring because neither muscle is shortening or lengthening. During the acceleration and follow-through phase, adduction occurs, but a slight pronation also occurs. So first, whenever the wrist abducts, when releasing the football, the hand pronates in the direction that you are throwing the football to. So as you're throwing it, your wrist is abducting, but as you release, your hand kind of pronates in the direction that you're throwing it to. The muscles to do this are the flexor carpi ulnaris, the extensor carpi ulnaris, and the extensor carpi radialis longus. And the plane of motion occurring at all 4 phases is frontal. The acetobulofemoral joint, or the hip joint. During the early cocking phase, external rotation is occurring at the hips. The muscles being used to activate this are the 6 deep lateral rotators, the biceps femoris, and the gluteus maximus muscles. All of these help assist and activate the muscles to externally rotate at the hips. During the late cocking phase, the hips are still being externally rotated, but the hips are also being extended at this phase. And this is because the hips are being opened up externally and the back leg is extending backwards. And this kind of helps create a torque and a bit of momentum in your throw. The muscles being used during this phase are the 6 deep lateral rotators, biceps femoris, the gluteus maximus, and the pectineus muscles, the semitendinosus muscles, and the semimembraneous muscles, if I'm pronouncing those at all right. During the acceleration and follow-through phase, the hips are being internally rotated. This helps create a torque that provides power to the action of throwing, and it's kind of like a slingshot whenever you throw the football, and it provides power and accuracy in the way or the direction that you're throwing the football to. The agonist muscles being used are the gluteus maximus, the gluteus minimus, the gluteus medius, the tensor fasciae latae muscles. All of these help internally rotate the hips. And the plane of motion occurring at all 4 phases are transverse because rotation is occurring at the hips. And you could say sagittal is occurring at the late cocking phase because hip extension is occurring. The tibiofemoral joint, or the knee joint. During the early cocking phase, flexion is occurring at the knee. The agonist muscles flexing the knee are the biceps femoris, the semitendinosus muscles, and the semimembraneous muscles. These muscles contract concentrically because it's shortening the load on the knee. During the late cocking phase, the tibiofemoral joint begins to extend. The knee contracts concentrically during the extension, and the muscles being used to activate this are the rectus femoris, the vastus lateralis, the vastus intermedius, and the vastus medialis, which are the quadricep muscles essentially. The extension is important during a football throw because it transfers the energy from the back leg and helps with the momentum of your throw. During the acceleration, internal rotation occurs at the knee joint slightly. During the action, when the thrower plants his back leg into the ground and begins to throw, his knee rotates internally, providing a little bit of torque to rotate his knee. And the muscles being used during this movement are the semimentindius muscles, semimembraneous muscles, and the popliteus muscles. And during the follow-through, the knee joint is directed towards the direction of the throw. The tibiofemoral joint and its agonist muscles begin to relax, and all of the important movements such as flexion, extension, and internal rotation has occurred in the football throw. The talocrural and the subtalar joint. During the early cocking phase, plantar flexion is occurring. During the action, the thrower's dominant foot is back, and it begins to slightly flex during a football throw. The contraction is isometric because the muscles are neither lengthening or shortening. The muscles being used are the gastrocnemius, the plantaris, the soleus, the peroneus longus, and the fibularis longus. These muscles all work together to flex the ankle or the foot. During the late cocking phase, it's similar to the previous phase. Plantar flexion is occurring at the foot joint. As the thrower plants his back leg into the ground to create a force that starts from his body and works its way up to successfully throw a football, the muscles being used are the same as the gastrocnemius, the soleus, the plantaris, the peroneus longus, and the fibularis longus. During the acceleration, dorsiflexion occurs. When the thrower steps forward into his pass, the foot lifts in a dorsiflexion movement right during the acceleration phase. The muscles being used are the tibialis anterior, the extensor hallis longus, and the extensor digitorum longus. During the follow-through, plantar flexion occurs during and after the throw. The muscles used to accomplish this are the gastrocnemius, the plantaris, the soleus, peroneus longus, and the fibularis longus. And during all 4 phases, the planes of motion occurring is sagittal.